Hi, my name is Rowena. I'm going to be performing a central line dressing change. First, I'm going to go ahead and verify the orders, make sure that I do have an order for dressing change for the central line. After verifying, I'm going to go ahead and knock on the door. I'm introduce myself to the patient. Hello, Mr. Smith. My name is Rowena. I'm here because there's an order for your dressing change, central dressing change. um, Dressing to be changed. Can you please verify your date of birth and your name? And then I'm going to go ahead and check the wristband also to make sure that um, it's the right patient. I'm also going to be explaining the procedure and ask the patient if he has any questions. He doesn't have any questions at this time, so I'm going to go ahead and gather my belonging, my supplies. Once I've gathered my supplies, I'm going to do a hand hygiene, and then I am going to wear a mask to protect the site to make sure that it is asepsis. I'm also going to be asking the patient to either turn their head to the side or wear a mask. And this time they asked to wear a mask. So what I'll do first is I'll put my mask first. And I do this so I could protect the patient, so I don't breathe on the central line area. I'm also going to put a mask on the patient. And then anybody, visitors or anybody else around the area, I'm also going to be asking them to wear a mask just to protect the area. So now I'm going to go ahead and put on clean gloves. So after that, I'm going to hand hygiene again and then put clean gloves on. I'm going to ask if the patient has any pain at the site, any tenderness. I'm going to go ahead and look, assess at the area, if the dressing is soiled, if there are any drainage on it. It looks good. So what we want to do now is make sure to start peeling from the side of the dressing, from the corners, and then make sure to stabilize the catheter. So I'm gonna go ahead and do that with one hand, and we'll go ahead and peel the corners. And then we want to make sure that we also peel away from the catheter side to make sure that we don't pull it out by accident. Okay, make sure it's stable. And once it's done, just gonna go to the trash and biohazard. And then after that, I'm gonna go ahead and observe, make sure that palpate a little bit around surrounding areas. Make sure there's no tenderness, no pain, no drainage, no fluids in the subacute area. And after that, it looks good. I'm going to go ahead and take off my gloves. And patient does not complain of any pain. So I'll take off my gloves. I'm going to do hand hygiene. I'm going to go ahead and open up my catheter dressing kit. And I'll make sure to open it away from me and just touch the edges. And then flip this over to make sure that we remain aseptic. So after that, I'm going to go ahead and grab the gloves, sterile gloves, ensuring that I don't just touch anything else. So the gloves here, and make sure we just touch this part and over, opening up just in the corners, 1 inch. So now we're gonna make sure that my hands doesn't go down the table because we want to make sure that it stays up. So I'm gonna go ahead and grab the outside part of the glove. Place it on. Ensuring that I only touch that part of the glove. And then we're going to do the other side. Making sure to only touch that part of the glove. Outer part of it. Okay. Now that I'm on the sepsis, I'm going to go ahead and grab my chlorhexidine. I also have my handy here. So since this is chlorhexidine, I'm going to go ahead and do an up and down motion for 60 seconds. So, and then I have to make sure that I click this. When you hear that click, that's when it's ready. Make sure it's saturated. And once that's done, I'm going to go ahead and use this to hold the catheter. Make sure I don't touch anything. And I'm going to start in a circle motion and count to 60. 1, 2, 3, 4, 5, 6, 7, 8, 9, 10, 11, 12, 13, 14, 15, 16, 17, 18, 19, 49. And we want to make sure that we're not touching the catheter as well. And then now I'm going to go ahead and just press this down, making sure the catheter does not move. Now we can go ahead and let it down. And then this goes to trash. After that, we're going to go ahead and grab our Tegaderm. We need to make sure that this dries completely. And once it's dry completely, salt. Make sure that the catheter is secure. Place it down. I want to make sure that it's as airtight as possible. Once it's secure, I'm going to peel it off. Once it's peeled off, we're going to go ahead and write down the date and the initial of the sticker. And we want to make sure that it's not on the catheter, make sure it's on the side. Okay, so we write down date, initials, and time that we put it on. And then after that, we're going to go ask Mr. Smith. Mr. Smith, how are you feeling? Do you have any pain, any tenderness at the site? No? Okay, great. Do you have any questions for me? Okay. So after that, I'm going to go ahead and take off my gloves. I'm going to go ahead and do hand hygiene. Clean up my equipment. Probably put another glove and make sure to get everything. After that, I am going to go ahead and do a hand hygiene